And, well, it's not going to be pretty. An Obama administration official admitting the launch of Obamacare will definitely not go like clockwork.
Yes, this is happening. You know, people will get enrolled in coverage. They will have health coverage in January. Will it be as wonderful on the first day as it is on the 30th day or the 60th day or the 90th day or year 5? Maybe not. You know, I certainly wouldn't claim that, you know, we're not going to have any problems at all and everything's going to work perfectly. I'd like for that to happen, but it would be a surprise, I think, if that were to happen.
Well, you know, that's not good when even Obamacare officials are not expecting all to go well. Senator John Thune joins us.
Good evening, Greta.
Good evening, sir. He does say he would be surprised if it starts perfectly. I guess we would all agree on that. I mean, anything that was a surprise, but
right, yeah. Yeah, I wasn't real inspired by those comments, by the way.
No, neither was I.
You know,
I was trying to make it sound good.
Yeah, and you know, the ironic thing about it is you interviewed the last couple of interviews that you've had on the show tonight talking about the IRS. The IRS is going to have a big role in the implementation of Obamacare, which ought to bring great concern to all Americans.
You know, it's almost like the organization, and I'm sure there are many good men and women who work over at the Internal Revenue, but when you see this, you know, from top to bottom, whether it's spending $50 million in a 2-year period, we weren't able to audit the other years, so I'm sure that they're spending $50 million those other years too, on these ridiculous conferences, and they're spending wine and downloading porn on our dime. It's like, you know, it almost looks like a hoodlum organization, but like, you know, it's just terrible. I'm sure there are good people there, but it's disgusting.
Well, it is. It's outlandish, and some of the examples that you highlighted on this evening's show are you know, just so far over the top that it's hard, I think, for the average American to even relate to, and really it creates a great level of cynicism and frustration in the American public about their government. And I think it's an example of what happens when government gets too big. I mean, you got huge bureaucracies with huge chains of command and not a lot of accountability.
But it's like the worst organization for the Obama administration, for HHS to partner up with, is the IRS. Well, because this is an organization that is in trouble.
Sure, it is. And like I said, I think that there, on so many levels right now, the administration has a serious credibility gap with the American people because there isn't a trust there. And the IRS is probably the most symptomatic of that, but it's kind of endemic right now in a lot of different ways. And I think the concern that a lot of Americans have is you have this massive new bill, Obamacare, you know, 2,700 pages in law and 50,000 pages or whatever now. I've seen this. You've seen the stack. It's about this high in regulations.
That's for you. For me, it's like this.
Yeah, well, for you, it's
like, yeah,
we could put a couple of you up against that thing. But, you know, it is. It's just volumes and volumes and volumes. And so you have all these small businesses out there who are asking these questions, and I get it back in South Dakota. I get it when I travel around the country. I think anybody who is, you know, an elected official, when they go out and visit with their constituents, what you hear over and over and over again is, what is this going to mean? And more importantly, you know, I'm not going to hire because I'm really worried about these mandates. And if I'm somebody that's at that 50 employee threshold, or I've got employees that are working more than 30 hours a week, those are two kind of trigger points in the law that are going to make it very, very difficult for people to hire full-time workers. You're going to see a lot of people shift from full-time to part-time, which is going to decrease the take-home pay for a lot of Americans, not to mention the excessive increase we're going to see in the premiums.
Well, you talk about the premiums. Last week we had someone on and was talking about how the whole idea of the exchange would get a number of insurance companies in a state to sort of compete and drive the prices down. But you've got some situations, I think it's the state of Washington, that has only one participating insurance company in the exchange, so there's going to be no competition to draw that price down. So it's not going to be cheap. I mean, so these exchanges, you know, what we're seeing is that they're not living up to expectations, or at least some of them aren't.
Right, and there are a lot of them. You know, there's supposedly, I think, 34 that are supposed to be up and running by, you know, this October 1 enrollment period or whatever. But the other thing about it is, and this is where, you know, aside from the lack of competition that would be out there with these exchanges, is all the mandates in the bill are just going to raise rates. I mean, you've got, you know, so many mandated coverages, community rating, guarantee issue, all these things that are requirements now that are going to have to be part of an approved plan are going to mean that rates are going to go up. And it's inevitable. And then you add on all the taxes that were attached to medical providers, whether they're pharmaceutical companies or insurance companies or medical device manufacturers. everything about this is just going to lead to higher rates for a lot of Americans, and especially younger Americans, which is why you've got the Obama administration trying to work with the NFL and other sports organizations to get people to enroll. They need the people, the younger people, to enroll in this, not to pay the penalty and not join up, because they just can't pay for it.
Senator, as always, thank you. Nice to see you, sir.
Nice to see you, Greta. Thanks.
And coming